This time it's about the brain again. And I've been speaking about the brain, and I will keep speaking about the brain because the brain is so important, and especially important during perimenopause. Like, really important. What we can do in this phase of our life can have an effect on our health and for the rest of our life, and possibly even have an effect on how we're gonna die. Oh, but that's somber. So let's stay with the more positive stuff for now. I again am basing this information, this insight, on information I got from the podcast, The Diary of a CEO with Stephen Bartlett, and he was in conversation with Dr. Amen. Dr. Amen spoke about the brain and about ADD and ADHD and lots of other things. And he also spoke about different types of brain. That was new to me. I was not aware that there were different types of brain, but the ones he mentioned were like so clear, and it's just a few in his book. There's more and more detailed information, so check out the book. I think it's really worth it. I haven't read it yet. So there's the balanced brain, there's the spontaneous brain, there's the persistent brain, there's the sensitive brain, and there's the cautious brain. So these 5 brain types for now. And I am focusing in this video on the spontaneous brain because it had been resonating the highest with me. And what's specific about the spontaneous brain? It seeks novelty. It seeks surprises. It seeks the unknown. It thrives in such environments. And when that's not available, it goes out there and finds novelty, surprises, unknown. That's what this brain lives on. However, now in perimenopause, it could be, or generally it could be, that this type of brain, the spontaneous brain, is misinterpreted or misdiagnosed as an ADD brain or an ADHD brain, because what these two do and how they're operating is in a way pretty similar. Also ADD, ADHD, it's just we need something new, we need novelty, we need stimulus, we need input. It doesn't mean that I'm hyper all the time, but I focusing on the boring stuff? No. But what about that? Yeah, so these two are, in a way, they share some characteristics, but it is not said that the spontaneous brain is automatically for a person having ADD or ADHD. But what they do have in common is that oftentimes both share lower dopamine levels. And that's why they're thriving on this stimulus, on this newness, on this surprise, on the unknown, and to get out there and pioneer and learn about the cosmos and the world. And some ADD and ADHD patients, especially female patients, when they are diagnosed, they sometimes get like Ritalin, like that medication, which is increasing dopamine levels. And what some therapists have found, that before menstruation, for some women, the dopamine levels need to be increased even higher. They need a higher stimulus on that. Otherwise, they're just not functioning anymore. But why am I mentioning this? Because there's other levels how we can affect our dopamine levels. Because our brain generally, like what I've learned from Dr. Lemke, it's not that it's seeking dopamine. No, it's actually seeking balance and stability. If there is a dopamine spike, it seeks to find something to keep the balance. Or if it's like really, really low, it seeks to find something to get it back up. That's why cold showers or saunas or high intensity training are so good for our brain, because they are like stressors. They plummet. It's not fun to stand under the cold shower unless it's fun for you. It's a stressor, it's a challenge, and also high intensity training. It's like a lot of force on the body. So what the body then does in order to recreate this balance is increase levels of dopamine so that we're back at a more neutral level. So that's something which could be helpful for you. Maybe not for you. If you are diagnosed with ADD and ADHD, then speak with your healthcare provider and therapist. But if you notice, spontaneous brain, that resonates, maybe these things like saunas, cold showers, and high intensity training, or running up the stairs like really fast, or jumping like a maniac for 5 minutes to your favorite song, can be really helpful throughout perimenopause, and especially pre-menstruation, when our other levels of hormones like progesterone and estrogen drop, because those drops can have an effect on serotonin, and can have an effect on dopamine, and can have an effect on our sleep. And so if those levels of estrogen and progesterone are low, and possibly they have been low throughout the entire cycle because there was not really